During the week, we briefed the nation, actually it's last week, nation about the emergence of a new variant in the country known as Delta. This actually is driving the third wave, and would understand that if we look in terms of the waves that we've seen, we had the Alpha that drove the first wave, we had the Beta that drove the second wave, now Delta is driving the third wave in terms of domination of the numbers that we see in terms of the variant that is present. The Delta variant, as we all will remember what has been briefed, what we took you through last week, first identified in India, I think we need to say, in October last year. But I think where many people tend to say, why didn't you close the borders of India? And are forgetting that it's actually now has been detected in 85 countries, including several countries in the continent. And it's actually rapidly becoming the dominant variant in many countries. So the question around whether you should have closed India, I think does not arise, because when you look at where this variant exists and has been dominant, you'd see that that would have been a bit of a futile exercise if you take it that way. The team of scientists led by Professor Tulio Oliveira provided details about this new variant, and this highlighted that there's now good evidence that Delta is more transmissible than previously circulating viruses and other variants of concern, and that the Delta variant is quickly becoming the dominant variant in the country. You'd remember when we spoke, there was still data that was pending in relation to Gauteng. We can confirm that data has shown that Delta variant is also dominating in Gauteng. However, it is important to just remind the public that Beta variant is still prevalent as well and still spreading. So you do see some of the provinces, when you look at the numbers and you look at the trends, you still see them having Beta variant as dominant. Another important characteristics of the Delta variant is that the fact that whereas with those who were previously infected by Beta variant, or during the Beta, as Beta was dominating in the second wave, were immune from reinfection by both the Alpha and Beta variant. It is not the case with the Delta variant now. This means that those who have had COVID-19 are also at risk of reinfection by the Delta variant.